My name is Laurel Colombini, and I'll be comparing and contrasting healthcare across Finland and the United States. I'll be discussing topics such as population health, healthcare spending, healthcare systems, public and health prevention. One key difference is Finland has a publicly funded universal healthcare system, along with a very minimal private sector. The universal healthcare system focuses on disease prevention and public health promotion. There are 3 associated levels: primary care, primary level, which is composed of general practitioners that act as gatekeepers; a secondary level, which are district hospitals that offer much more specialized care, but must have a referral from the general practitioners; and a tertiary level, which is composed of 5 university teaching hospitals. These contain the most advanced medical facilities and equipment, and they are all located in major cities. Local governments are responsible for providing care to their residents. Even the university hospitals are funded by local municipalities, but the medical staff and their training is covered by the national government. Here in the United States, the delivery of healthcare coverage is much different. The United States does not have a universal healthcare and is mostly a free market. The majority of facilities where healthcare is delivered are privately owned businesses. Healthcare coverage is a combination of private health insurance and publicly funded health insurance, such as Medicaid or Medicare. Insurances dictate many aspects of obtaining care, such as whether or not the patient requires a referral from their primary care physician, which providers are in network, and which facilities the patient can go to for treatment. Insurances are often the gatekeepers. If we compare a metric of population health, such as infant mortality, there's a vast difference. Finland has one of the lowest infant mortality rates in the world at 2.3 deaths per 1,000 live births in 2010, while the United States comes in near the highest infant mortality rate at 6.1 deaths per 1,000 live births in the same time frame. As a wealthy and developed nation, the United States has significant opportunity for improvement here. Healthcare spending tends to be associated with positive outcomes. However, the United States spends a staggering 40% more dollars per capita, spending $10,209 compared to Finland's spending $4,173. Yet the United States continuously falls behind in population health, as we saw in the previous slide. Effective healthcare systems allow for the citizens within the nation to receive timely healthcare and preventative medicine. Flu immunization rates are a very important measure and demonstrate the level of influenza prevention among the nation. In the United States, 68% of adults aged 65 and over received their flu shots in 2015, compared to approximately 42% in Finland with the same parameters. In public and health prevention, childhood vaccination rates have similar public health policy in each country. In Finland, approximately 95% of children ages 19 to 35 months are considered fully vaccinated, while the United States has a 90% coverage. Finland offers free vaccinations for all of their approved vaccination schedule. Vaccination is voluntary, and they are all typically administered at local child welfare clinics. The United States also offers free vaccinations to qualifying children, which are those on publicly funded Medicaid through the Vaccines for Children program. Vaccination is also voluntary, and the vaccines are typically administered in a pediatrician office or the local health department. Safe drinking water tends to be a key marker for a nation to have a healthful and successful nation. Overall, citizens in both the United States and Finland feel their drinking water is reliable and safe. In Finland, the drinking water is mostly collected from groundwater or bodies of water. Their multi-level filtration system includes daily samples from the pipes and seasonally in the lakes. The procedure has consistently allowed their water to rank highly in both cleanliness and taste of their water. The drinking water is monitored by the Ministry of Agriculture and Forestry, as well as the Ministry of Social Affairs and Health. And the United States collects most of the majority of its water from the surface supply, such as lakes and reservoirs, which are sometimes thousands of miles away. The public water system is held to standards supplied by the Safe Water Drinking Act that was established in 1974. The public water system requires the EPA to follow specific requirements. These metrics are reported across the country in an annual consumer confidence report. This report lists level of contaminants and grades their compliance to the EPA standards. Since primary care in Finland is the first level of care available to the citizens, access to these practitioners is vital. According to the retrospective evaluation in 2010, there are approximately 225 general practitioners available per 100,000 residents. These practitioners are typically employed by the municipality. The United States has been struggling with a shortage of primary care providers. At the same time frame, the United States had less than 50 practitioners or general practitioners or primary care physicians per 100,000 residents. This shortage is attributed to lower salary and higher increased working demands placed on the primary care providers. Over the last 50 years, teen pregnancy has continued to drop in both Finland and the United States, as you can see in this graph. Among Western industrialized nations, the United States is substantially higher, averaging 21 pregnancies per 1,000 women ages 15 to 19 years old. There are significant disparities among geographic region and racial and ethnic backgrounds. In Finland, teen pregnancy rates are substantially lower, averaging 7 pregnancies per 1,000 women ages 15 to 19 years old. This is attributed to sexual health practices that are taught throughout their country and community health programs and family planning initiatives. There are still disparities within the socioeconomic classes. In summary, the universal healthcare approach seems to offer many benefits. However, it is difficult to compare many of the statistics because Finland is about 29 times smaller than the United States. As you can see on this map, Finland is about the size of Michigan, Ohio, and Kentucky put together. The vast population in the United States creates challenges in itself. The United States ranks 4th in the world among population with a staggering 326 million and growing, while Finland ranks 118th with approximately 5.2 million residents. While the publicly funded healthcare in Finland tends to offer a preventative approach and has conquered the high spending on healthcare, spending about 52.4% less than the United States annually per capita on health expenditures, its taxation rate is significantly higher, with a top tax rate of 51.6%. But you must consider, what are you getting for these elevated taxes? Minimal out-of-pocket costs, and many other social benefits to support a family. Yet, even with all of these differences, all these various approaches to healthcare, the average life expectancy still only differs by 1 year. In the United States, 81 years old, and in Finland, 80 years is the average life expectancy. Thank you.